brain tumor symptoms and signs. Headache, which may be severe and worsening which activity or in the early morning. Ang early morning talaga kasi sumasakit yung ulo, more on every morning.
Minsan.
Severe and worsening. Yung worsening, maybe it's either
Oh,
worse
hindi.
at saka severe.
Oh.
Severe hindi naman siguro. Ito, seizure. People may experience different types of seizure. Certain drugs can help prevent or control them. Yun na yung nagagamot na talaga. Ito na nga yung personality or memory changes.
Minsan nagtataka
How
ko.
do you feel when you have a brain tumor? Well, basahin. General signs and symptoms caused by brain tumors may include new onset or change in pattern of headaches. Nag-change ba yung masakit sa ulo mo? Nag-change or talagang sa isang lugar lang? Yung tipong dito masakit tapos sa susunod or maya-maya dito or dito.
Nag-change. Dito nga, yan. Dito, tapos minsan dito. Ganyan. Nag-change talaga siya.
Baka mamaya, dito.
Tapos, minsan.
Yung may makakalimutan ba? Yung
Alzheimer?
Oo, early. Yung onset.
Minsan.
Early onset Alzheimer.
Minsan
Yung sa mga bata.
alam mo yung nakakatulog naman ako ng maayos, tapos nung pagising sa umaga, magtaka na ako, masakit ang ulo ko. Alam naman yan.
Tapos meron pa. Ito, new onset.
Hindi din naman ako nakakalimot eh.
Ano nga bang oras?
12. Hindi.
Paparamdam na itong isang.
Sino yan?
Yung lalo kausap pag alis. Okay. Ito. Saan? Ito, new onset or change in pattern of headaches. And headaches that gradually become more frequent and more severe. Yung alam mo tipong pasakit na nag-mild pa tapos mamaya sumasakit. Ganun. Headaches that gradually become more frequent and more severe. Unexplained. Unexplained nausea or vomiting. Na hindi mo maramdaman, magsusuka ka.
Doon sa kabila, pagising ko, medyo na. Tapos pangalawa nun, kaya ko pa. Pangatlo, medyo okay pa. Tapos yung last nun, higa na ako, hindi na kaya.
Ito, do brain tumor symptoms come unsuddenly? Ano to siya? Question. Ito yung sagot. Sign and symptoms of brain or spinal cord tumors may develop gradually and become worse over time, or they can happen suddenly, such as with a seizure. Meron naman seizure to. Can you have a brain tumor and not know? Because different areas of the brain control different function of the body. Where the tumor lies affects the symptoms you get. Some tumors have no symptoms. Wala nang symptoms yung mga ibang tumor. Kaya yung iba, late na nadidetect.
Tatakan na lang, no?
Tatakan na lang.
Biglaan.
Nasa stage
3 kadalasan.
Yung anak ko yun.
3 na tapos aangat agad mag-4.
Ano yun na yan? Ito, brain yun.
Yun na nga yung, di ba nung bago pa nga ako sa Malabon, napag-usapan yung lagi, yun yung iniisip mo lang.
Bago pa nga, yun eh. Wala yung wala talaga yung symptoms. As in, wala.
Ano lang yun? Bagsak?
Oo, nalumpo lang daw. Yung parang
wala na lakas.
Oo, bumagsak lang siya. Tapos nagtaka na yung tatay niya, kaya di na sa hospital, doon na nalaman na malala na, nasa stage 3 na yun.
Tapos bata pa nga yun, no?
Oo, kasi nga wala.
18? 20?
Nung time na namatay siya,
ay,
wala pa nasa 24 na yun ngayon eh.
Kasi ano ko lang ata yun? O mas maano pa ako?
Oo. O basta medyo tawag ito? Yun na, stage 4, stage 3 tapos
ang bilis umano.
Tapos ang bilis kumalat. Tapos, hindi na ang tumor na nga, kasi ang tumor sa mga cancer. Ang cancer kasi ng sakit yun ang pinaka-traidor. Kahit nagagamot ka, oo, nadugtong-dugtungan ng buhay mo.
Pero di nawawala.
Hindi na nawawala. Yung tipong dinudugtungan lang yung buhay mo. At saka hindi talaga yan 100% na nawawala. Kaya yun yung sakit na nakakataka pag dumapo. Saan pa na? Ano yun? Where the tumor lies affects the symptoms you get. Some tumors have no symptoms until they're large and then cause a serious rapid decline in health. Other tumors may have symptoms that develop slowly. Yung iba talaga mayroong sintomas na nag-develop talaga ang dahan-dahan. Kaya nalalaman o nadidetect. How can I test myself for a brain tumor? Diagnosis of a brain tumor is done by a neurologic exam by a neurologist or neurosurgeon. Yun yung CT scan. Ito, CT scan, computer tomography scan, and or magnetic resonance imaging or MRI, and other tests like an angiogram, spinal tap, and biopsy. Your diagnosis helps predict the treatment. CT scan talaga. CT scan siya. Brain tumor warning sign types. Though brain tumors cause headache every day, severe, persistent headaches are a common symptoms of brain tumors. Isa sa mga common symptoms yan. Pero hindi naman ibig sabihin na sumakit yung ulo mo, may tumor ka na. Siyempre hindi naman ibig sabihin. Ano lang siya, common lang. Most headache, however, are not a sign of a tumor or cancer, di ba?
Most.
Oo, most lang. Yung talagang, ito. What was your first brain tumor symptoms? First sign and symptoms of a brain tumor may be severe headaches and seizure. O, di ba? Yun yung unang-unang symptoms sa may tumor ka. Ikaw naman, headache lang. Hindi ka naman nagsisseizure, di ba? Maybe headaches and seizure, severe, persistent headaches that may not be related to an existing illness, such as migraine, is considered a common finding in patient with a brain tumor.
Ganon, na syempre, yan talaga yung nakikita, di ba?
Oo. Yes.
Posible,
Is considered a common finding in patient with a brain tumor, such as migraine. Pain may be worse in the morning and may be associated with nausea or vomiting. Pain. Nag-worse talaga siya sa morning. Anong oras ba nag-worse niya pag sumasakit yung ulo mo? Hindi naman morning, di ba?
Dati, nakakaramdam ako dati morning.
Yung worst.
Pero hindi naman.
Tapos nagsusuka. Ganun. Yung habang sumasakit yung ulo mo, nasusuka.
Oo, na minsan din, masasabi mo sa sarili mo, akala mo may laman, ganun.
What the brain tumor headaches feels like? Every patient experience is unique, but headache. Bakit pa? Dito talaga itong headache, di maalis-alis.
Kasi ngayon naumpisa.
Headaches associated with brain.
Alam mo, nagtataka ako nung na-confirm nga ako sa Davao, sa may SPMC. Bakit
Hindi ka ba sinitescan?
Bakit?
Patayin mo ngayon.
Bakit? Hindi. Bago yan. Bakit binigyan ako ng CT scan form?
Ganun. Malay mo. Ganun naman talaga ang mga yung mga nagpa-fine. Confine, pag masakit yung ulo mo, nako-confine ka, tapos hindi mo naman nire-request sa kanilang magpa-CT scan ka, kaya talagang binibigyan ka din ng CT scan kasi kung gusto mo, pwede, para makita kasi, di ba masakit ang ulo mo, kaya ka na-confine, sabi headache lang. Kung gusto mo talagang malaman, at least may form ka na. Fill up mo na lang yun. Yun. Ito, saan ba yan? Ano ba yung binasa ko?
Price range yun. Price range. Form tsaka price range.
Ito. What brain tumor headaches feel like? And every patient's pain experience is unique, but headaches associated with brain tumors tend to be constant. Hindi naman. Bakit? Constant ba sa masakit yung ulo mo?
Kadalasan?
Oo. Yung halos everyday.
Kadalasan.
So, brain tumors tend to be constant.
Kadalasan.
Ako, masakit na yung ulo ko pag mainit ang panahon.
Kadalasan. Tsaka pag mainit, mas lalo.
Constant.
Minsan nagaganyan nga ako sa ulo ko eh.
Constant.
Sakit.
And are worse at night or in the early morning. Night at saka early morning. They are often described as dull pressure type. Headaches through some patient also experience sharp or stabbing pain. So, ano yung stabbing pain?
Google.
Google. Oh, stabbing pain.
Wala na akong imbit.
Yan naman talaga ginagawa ko.
Kung nga din, nagpapalaban na lang din ako ng Google.
Stabbing headache.
Yun na yung katuwang.
Describe as like an ice pick. Yung parang tinutusok ang ice pick yung ulo mo.
Tama. Yung, maalala mo minsan na,
Ice pick headache tumor.
maalala mo yung minsan na, yung sinasabi ko na, ano bang gano'n, no? Parang, gano'n.
Ito. Ice pick headaches are painful. Severe headaches that
Ice
come
pick.
on suddenly.
Ice pick is family lang naman sa night, di ba?
Oh, ice
Family
pick.
lang naman sila. Maliit naman yun. Kahit nga yung needle eh.
Parang toothpick.
Oo, ganun na.
Kaya nga pick ito.
Ice pick.
They're often described as feeling like a stabbing blow or a series of stabs from an ice pick. They gave no warning before striking. Yung tipong sumakit na naman bigla, hindi naman nagpapasintabi. They gave no warning before striking and can be excruciating and debilitating. They're also brief, typically lasting longer than a minute. Hindi lang siya minuto, di ba?
Hindi.
Yes. Tingnan mo, typically lasting no longer than a minute. What does a brain tumor headache affect? Can brain tumors cause ice pick headache? Severe, persistent headaches are common symptoms of brain tumors. Most headaches, however, are not a sign of tumor or cancer. Hindi naman talaga. Malay mo, naunto ka lang kaya sumakit yung ulo mo. What disease cause ice pick headache? They occur without an identifiable cause, or they could develop from an underlying disease. Some things that are possible related to primary stabbing headache are herpes zoster, stroke, migraine, and multiple sclerosis. The exact cause of ice pick headaches is unknown. Hindi pa nalaman kung ano talagang exact na dahilan kung bakit nag-ice pick headache.
Tubig na. Yes.
Should I worry about sharp pains in my head? Headache symptoms you should worry about. A headache typically causes pain in your head, face, or neck area. Get urgent medical attention if you have severe unusual pain or other signs and symptoms. Your headache may be a sign of underlying illness or health condition. Oo nga eh. You should be worried.
Ano yan?
Tulog na.
Ayusin mo yung ulan mo.
Should I worry about sharp pains in my head? Oh, you should be worried.
Ayusin mo yung ulan mo.
there any warning sign of a brain aneurysm? In extremely rare
Oo nga,
cases,
yung
the
aneurysm
sudden
pala.
and severe type of pain that characterize ice-pick headaches can also be caused by aneurysm or bleed in brain. However, this is unlikely. Pero bihira lang, napaka-rare. Are ice-pick headaches something to worry about? Despite their severity, ice-pick headaches aren't dangerous. They don't require medical intervention unless they occur frequently or interfere with your daily life. Since they occur without warning, it's important to do what you can to avoid them if they happen with any type of frequency. What does an aneurysm headache feel like? Symptom of ruptured brain aneurysm, yun yung pumutok yung ugat sa utak mo, usually begin with a sudden agonizing headache. It's been like to being hit on the head, resulting in a blinding pain unlike anything experienced before. Other symptoms of a ruptured brain aneurysm also tend to come on suddenly and may include feeling or being sick. Brain aneurysm. Can dehydration cause ice-pick headache? When should you see a doctor for ice-pick headache? If you get watery or red eyes, or runny or stuffy nose, or swelling and flushing of your face with a stabbing pains, you may have a different headache disorder called short-lasting and lateral neuralgiform headache attacks with conjunctival injection and tearing, or short-lasting and lateral neuralgiform headache. Dito na ako sa ice-pick Doon na ako sa magaling. Ito ang ice-pick headache coronavirus. Kaloka naman to. Ice-pick headache coronavirus.
Okay.
Maraming uri. Marami kasing uri ng cancer.